Hi, I'm Darnell with Live Young Lifestyle, and I'm here today with Dr. Marc Mani, plastic surgeon from Beverly Hills, California, and Lynda Barens from Beauty Realize, who's a patient advocate for plastic surgery. Today, we are going to talk about the stigma behind having work done, especially in Hollywood. So many of these stars that we look up to, who are selling creams on late night infomercials, are people that have had facelifts before, and they're just not admitting it.
I mean, I do a lot of facelifts on actresses, actors, celebrities, and it's something that, I take pride in the fact that people can't tell, and so when they don't admit it, it's kind of flattering in a way.
Right.
But at the same time, there's just such a trend towards non-invasive procedures, and a lot of these filler companies, laser companies are taking credit. And I've said this before, I've had multiple actresses that I've done my TCF lift on, and they've been asked after their procedure to be the worldwide spokesperson for that filler company. It's a total composite flap lift, and I did that in my academic article, which I published about the technique for other plastic surgeons. I like to try to call it that just because it's not a conventional facelift. It's the state-of-the-art in surgical facial rejuvenation.
Right.
But the modern facelift, and particularly the way I've kind of honed and refined it over 20 plus years of doing this, is not the same procedure that people are used to seeing, where you look tight, you look pulled. But at the same time, there's a lot of art to this. There's a lot of nuance, and as an artist who went into this field, that's something that I value, and I think my patients value also.
But it is kind of a new way, a cutting-edge way, no pun intended, to do a more modern, natural facelift. You're still going under the knife. The incisions are still around the ears, although yours are invisible, I have to say. But people are still doing that, and they're not only are they not saying that they did it, they're denying it.
Well, they don't share, Darnell. They don't share because they feel that they look so good that they don't have to share.
Right.
They just get a new haircut, they get new makeup, they get things done as
They
stylish,
disappear for a
whatever.
month.
Exactly.
Yeah.
They're gone, and then nobody knows it. Oh my God, you just look so much better and fresher.
Right.
And it's...
They call it a refresh. I mean,
It does.
I always say this, there's a stigma attached to the word facelift. People don't even like to talk about their face. They like to talk, they don't like to talk about surgery. They don't like to say they've had a facelift because there's a stigma where people think that that's something you only do when you're old and like, I'm over the hill. But the fact is, it's actually our knowledge of anatomy and the art of it has gotten better and better. And I think you were saying to me earlier that it is a little bit annoying that there's this trend towards denying this, and it's not good for the general public to think that a lot of the stars, even in their 40s, a lot of the women in their 40s, maybe men at a little bit of a later age, they have had facelifts. They've just had it very well done and precisely and artfully done. And people think that they just look that way naturally, or that they had fillers or laser treatment.
And that's why people don't know that they've done it. They find great surgeons. They do it at a time where you don't really need it, but you keep on top of it and it makes a difference. And a lot of Hollywood celebrities, that's what they do. But they're just saying they're doing non-invasive stuff. Or I've even known of some people that have had this done who straight out say, I just want to age gracefully. Botox, I have a bad reaction to Botox. And I look at them and they're like, my age, 49, and I'm just like, who are you kidding?
Yeah, I had a patient on a big talk show I saw a couple of weeks ago, and the host was saying, oh, you look so great, what's your secret? And she's 61, she looks like she's probably 42. I did her face probably 3 years ago, and she was saying that her secret is the fact that she has whatever it is. I mean, I do this, I do that, I have a younger boyfriend, that type of thing.
Dr. Mani, almost nobody admits to having surgery. They say, I got a new hairdo, I started taking naps, I found this miracle cream, I went on a yoga retreat, I'm eating paleo now, I'm eating vegan, I basically stopped eating. They can use all of these excuses because the work is getting so good, it doesn't look like work anymore. It's almost invisible. What they don't say is, I got a really good facelift from an amazing doctor, like you.
I'm proud of the fact that it's, the work that I do is indistinguishable from staying young naturally.
Right.
And, my goal is always to make someone be that person who people say she never ages. And so they have speculation in the tabloids, which I've seen about my patients multiple times, where other surgeons who do that type of speculation will say, I think she's had filler, she's doing this well, she's doing that well, but you can't really pinpoint that they've had a facelift.
But it's a very weird thing that's happening, and I think there is so many excuses with the non-invasive procedures that are helping people disguise the fact that they are going under the knife. I mean, I used to watch that show, The Golden Girls, that was like late 80s, early 90s. But if you were to cast that same age right now in the time that show started, the actresses playing the little old ladies would be people like Halle Berry and Rita Wilson, Kim Cattrall from Sex and the City. And here's one. Christy Brinkley is older than all of the women in the original show. She's 64 and looks amazing. But they aren't even the only ones that could be cast. Sandra Bullock would be up for the role, as well as Michelle Pfeiffer, even Cindy Crawford. I mean, the list will go on. You could not put enough makeup or wigs on those women to make them look the part of a little old lady. And guess who is 80 years old? Okay, don't guess. I'm gonna tell you. Jane Fonda. And even she'll tell you it's not just from the workouts. So we are aging, or we're faking it, we're hiding it much better than we used to. And there's so many different techniques that people are coming up with. There's all the non-invasive stuff. But a 60-year-old today doesn't look like a 60-year-old did in the 80s or even 90s. So we're able to, with a little nip and tuck here, with a little laser there, with a little Botox there, we're able to play the smoke and mirrors of the aging game. But the problem that I have with it is that the people that are far away from Hollywood, who don't really know what's going on, what are they thinking? They're thinking these people are like aliens. They're just one of God's chosen people to just be beautiful. And they're not really understanding there's a lot of money that goes into that. There's a lot of research that goes into that. They're having people like you, Lynda, show them where to go, what to do, who should cut on their face. And then they're hiding the fact that they did anything. So people that don't understand, the anti-aging global market is a $200 billion industry. It's insane how much people spend money, and I'm guilty of it, because if somebody said, hey, drink this potion or do this and you're gonna look 10 years younger, I don't care what it costs. I will figure out a way to do the research and see, is that really a viable
Darnell,
thing?
I take your vitamins.
So do I, by the way.
Yay, do you like them?
Yeah,
I
do.
came out with a vitamin line. I'll tell you all about it later.
Excellent, yes.
Thanks. But so that's, I kind of feel like those people at home that don't have the great plastic surgeons in their, in their back pocket on speed dial, that don't have a great dermatologist, and just look at these stars on the red carpet and think like, maybe they're born with it. No, they're really not. I mean, I think there are beautiful people that are blessed, but somebody who's 60 years old, who looks like they're 40 and says they've never done anything, I call BS on that.
Most likely they're lying. I mean, Lynda and I have worked with a lot of them. But at the same time, it's all under the table, it's all word of mouth, and they, hairstylists know, but they will never talk. And,
right.
We've had patients that won't even come to the office for follow-up. I go do house calls. I've had ones that wanted their surgery to start in the middle of the night so the paparazzi wouldn't be around, which is a little bit of paranoia, but you have to make those indulgences.
Yeah. But for me, I am going to tell you to take the right vitamins. I am going to tell you need to start weight training instead of being on a treadmill. I am going to tell you need to use Retin-A. I'm going to tell you all the stuff that you need to do, but I'm also going to be very honest when I go under the knife, because then I feel like I'm helping people. And I'm grateful for both of you guys.
So much.
And that's a really good way to live young.